Probability of cancer in pulmonary nodules detected on first screening, computed tomography. Pulmonary nodule is a small round or oval-shaped growth in the lung. It is sometimes also called a spot on the lung or a cone lesion. Pulmonary nodules are generally smaller than 3 cm in diameter. If the growth is larger than that, it is known as a pulmonary mass. A mass is more likely to represent a cancer than is a nodule. What causes pulmonary nodules? Benign pulmonary nodules can have a wide variety of causes. Many are the results of inflammation in the lungs as a result of an injection or disease of an infection, or a disease producing inflammation in the body. The nodule may represent an active process or be the result of scar tissue formation related to prior inflammation. Benign developmental lesions may also appear as nodules.
Thoracic surgeon at St. Joseph's Hospital Medical Center in Phoenix, Arizona. I'd like to talk with you a little bit today about the pulmonary nodule. First off, what exactly is a solitary pulmonary nodule? Well, technically, it's a finding on imaging studies of the lung of up to 3 centimeters in size on the lung tissue that's usually seen on a chest x-ray or a CT scan of the chest. Usually these findings are in patients who rarely have no symptoms at all, so they're considered incidental findings. So then we have to ask, what is this nodule? Where did it come from? Well, there's a huge differential diagnosis for these nodules. They can be benign or malignant, meaning it could be a cancer.
Cancer, also known as a malignant tumor or malignant neoplasm, is a group of diseases involving abnormal cellular growth with the potential to invade or spread to other parts of the body. Not all the tumors are cancerous. Benign tumors thus spread to other parts of the body.
The human body is a complex and wondrous living machine. Like any machine, our bodies are composed of smaller parts that work together. The various tasks that are performed each day, such as breathing, eating, and digesting food, and the movement of our blood, are performed by specialized structures known as organs. Examples of organs include the lungs, stomach, heart, and brain. All of these organs and other body parts like our skin and muscles are made of smaller living units called cells. Our lungs are a good example of how many cells work together to perform a specialized task. The cells in our lungs work together to allow us to take in oxygen from the air and get rid of waste products such as carbon dioxide. Our lungs are composed of many millions of cells working together to accomplish this task. Cancer is the result of a long process that begins when one of the cells in an organ or tissue becomes damaged or altered in a way that causes it to break free from the normal controls that allow our cells to work together in harmony.
Computed tomography is an imaging procedure that uses special X-ray equipment to create a series of detailed pictures or scans of areas inside the body. It is also called computerized tomography and computerized axial tomography scanning. Computed tomography in cancer. Computed tomography may be used to help detect abnormal growth, to help diagnose tumors, to provide information about the extent or stage of disease, to help in guiding biopsy procedures or in planning treatment, to determine whether a cancer is responding to treatment, and to monitor for recurrence. Probability of cancer in pulmonary nodules detected on first screening computed tomography. Currently, the follow-up strategy is based on the size of the largest detected lesion and may vary depending on whether the lung nodule is solid or non-solid. Our study showed that in 20% of the participants, the largest lung nodule wasn't the one that was malignant or determined to be malignant on follow-up. Also, volumetric computed tomography may be useful to characterize volume and mass. A second computed tomography required to determine the growth rate or a change in mass, and currently volumetric computed tomography can be performed accurately for non-solid or part-solid lesions.
A CT scan, also known as a CAT scan or computerized axial tomography, is a painless diagnostic test that uses X-rays and computers to create cross-sectional images of bones and tissues inside your body. Your doctor may recommend a CT scan to examine your body for any of the following: blood clots, broken bones, cancerous tumors, infections, internal injuries and bleeding, and signs of heart and vascular disease. A CT scan helps your doctor select the correct location for surgery, biopsy, or radiation therapy, check the treatment of cancer or heart disease, and check your condition after surgery.